Today we're here to talk to a psychiatrist to get the lowdown about anxiety.
This is Dr. Melissa Welby. She's a psychiatrist, and she's going to give us the breakdown about what anxiety really is.
Hi.
Hi.
So let's start with kind of a obvious question in what exactly is the definition of anxiety, or what is anxiety?
Anxiety is a normal feeling. We use anxiety every day to help us do things better, to pay attention to things that we worry about. So anxiety is not a bad thing. It's very helpful, right? If you have a job interview and you're feeling anxious, you're probably going to prepare. If you don't feel any anxiety, then you might just walk in and almost be too casual. So anxiety is a very functional, it plays a role in our society and our success in doing well. So it's when anxiety takes over and dominates our lives that it becomes a problem. So then it's irrational. It's completely disproportionate to what we're worrying about. So, for example, maybe you have an exam next week and you're feeling a little anxious. You maybe have a C and you're worried about failing, and so you think, well, I'm going to really work hard and I'm going to prepare. Whereas, that would be a normal response. Somebody else, their anxiety may continue to build, and then they start really worrying, I think I'm going to fail. So at that point, there's a choice, right? So you can either start to use some coping mechanisms to reduce your anxiety, kind of, get yourself back together and work it out, go for a run, do some yoga, take some deep breaths, a lot of different options in terms of how you manage your anxiety at that point, get refocused and restart studying. Whereas somebody else, their anxiety may completely take over. And so they start what we call catastrophizing. So everything is a catastrophe. So you feel like you're about to be eaten by a bear, but you're not. And so in those situations, it becomes difficult to function. You actually can't study because your mind is so worried. At that point, that's when anxiety is a problem. It's no longer a normal human emotion. It is, but it's just gone crazy, for lack of a better word. People with anxiety, there's a fear center in your brain that gets activated. So it's called the amygdala. And when the amygdala gets activated, it sets off this fight or flight response. Adrenaline is released, your heart goes faster. So those are all of the feelings that happen when you're about to be eaten by a bear. And you can imagine this was an evolutionary, very useful tool, right? I mean, if you just sit around like, whatever, the dinosaur's coming, it's not going to go well for you. So, these are important evolutionary responses. But with people that may have, let's say, a genetic predisposition for anxiety, so anxiety runs in their family, it's genetic, it's a medical condition, this can contribute to this fear center going awry. And so it gets triggered easily. So, like, for example, it's that exam where it's a whole fight or flight response that happens when it's going to be okay, really in the long run, and that's what leads to some of the catastrophizing, where someone might say, I'm never going to pass this exam, I'm going to fail this class, I'm probably going to fail out of college, I'm likely to be homeless. And it's like you've left the current situation, the moment in time that you're in, and you're living in the future. And this is what happens when people have anxiety, is that they constantly are projecting to the future of all of these disasters that are about to happen based upon every single thing that they do. So part of the treatment is, cognitive behavioral therapy is wonderful in breaking down anxiety and sort of analyzing, your cognitions, your thoughts, your automatic thoughts. If this happens, then this will happen. So a lot of times the jumps that people make with anxiety are totally irrational. There's no reason that just because you get, a C that you're going to be homeless. That doesn't make sense. But because the feelings are so strong, people have trouble convincing their brains. And so that's where cognitive behavioral therapy can come in, where those automatic thoughts are sort of broken down, disproven a lot of times, and replaced with other thoughts that are more supportive. So that can be end up being very calming and help people kind of take control of their feelings, of their thoughts, because a lot of times our thoughts control our feelings. And so, we can convince ourselves that something's going to happen and then cause panic. So a lot of the treatments for anxiety are about sort of shifting the focus of those thoughts. What I work with people frequently on is getting out of the future. So let's come back to today. So there are a lot of techniques to live in the day a little bit more effectively. Mindfulness techniques, sort of grounding techniques, where if I can catch myself projecting for the future and, thinking of all of these disasters that are going to happen, you know what? We have no control over the future. We have no idea what's going to happen. What we can control is how we feel right now and the choices that we're making. So, whether it's deep breathing, whether it's going for a walk outside and looking at nature, doing some things that might sound cheesy, but they're really grounding, and they, can train your brain to stay in the day and appreciate the moment and think of solutions and not just panic and catastrophize. So, I think exercise is a fantastic way to manage anxiety. If you have all of that pent up adrenaline coursing through your body, go box, go, sprint down the road, do something that's going to match that level of intensity, and, it'll calm down. I mean, anxiety it's like a mountain. It can, you start to worry or have a panic attack, it's going to raise, it's going to come down. And so the key is, can you just let it come down? Can you do things that help it? Because there are a lot of things that people will do that actually will make it worse. For example, caffeine. Caffeine is not a friend to people with anxiety. It's fuel on the fire. And so, I suggest to people all the time, have a decaf. People really don't want to hear that, but it's true. I mean, if you add gasoline on a fire, it's going to get bigger. Caffeine is a big culprit. Alcohol, not great for people who are anxious. And people who are anxious might have the tendency to want to self-medicate and, if I go to this party and I have a few drinks, then I don't have to worry and then I'm going to be fun. But what happens is that, it calms your anxiety for a little while. Mm-hmm. And then as it comes out of your system, anxiety builds. So alcohol is a depressant. Alcohol induces anxiety. So, for people that are anxious, they might notice the next day after they've had alcohol, their anxiety is so much worse. And then, it leads, you can see this cycle happening where, I just have to have another drink. I mean, this is what happens. There's a lot of comorbidity with anxiety and alcohol use. People are trying to feel better. And if you don't have coping mechanisms, there are lots of things that people will grab for because they're suffering. Anxiety is so uncomfortable. Mm-hmm. So, I try and help people learn some other tools, learn some tools that come from within and not need to, sort of dampen anxiety with a drug or alcohol or, doing things like that food, people use food for soothing. So there are a lot of things that can be done. And that's before we've gotten to the point of even considering medication. Mm-hmm. So there are lots of treatments for anxiety, medical treatments for anxiety. People still have to do the work to interrupt their automatic thinking process. It's a habit. Anxiety, a lot of times people have had it for many, many, many years. And so you're used to reacting a certain way, right? Mm-hmm. I see that train, I'm going to get anxious because I know I always get anxious, but really it's just that you got anxious one time when you were on the train.
Yeah, it's like me in a car. I got into 2 car accidents, and me in a car is like, I'm gonna die, and I'm just driving to the store.
Right.
All the time.
Right.
But it happens, triggers, all different kinds of triggers. Cars, dogs, talking to people, just waking up in the morning.
Right.
Gives me a trigger.
Right, and you can see how these associations that you make, even if I give you medicine, mm-hmm. that sort of turns the dial down on that chemical drive for the anxiety, so that fight or flight response, just sort of calms it down a little bit. If you don't break those associations, you're still going to feel anxious every time you see a dog or another human that you might have to speak with, yeah. Whatever it is that your trigger is. So, I think some people have the misconception that they can come to a psychiatrist and I'm going to give you great drugs. They're going to help you feel better, take all of your anxiety away. Sometimes it's a rude awakening for me to tell you, well, listen, I think that your anxiety can really benefit from medicine. But in addition to that, cognitive behavioral therapy, all of the other things that need to happen to break those habits. Otherwise, what's going to happen down the road? If you decide you want to go off of medicine, but you don't replace your coping mechanisms, then, you're going to be at high risk of relapse.
So what would it be like, all right, because a lot of people I know are like freaked out or scared or embarrassed or nervous to come and talk to somebody, whether it be a psychiatrist, a psychologist, any sort of doctor. So what exactly would you say to somebody that's like, I'm a little bit nervous, is there a way that you can kind of just like dispel all of that nervousness and all of that, taboo that comes with, oh, I'm talking to a therapist?
Right. I mean, it is intimidating. It's intimidating to walk into a stranger's office and, to open up and share all of your history and, your vulnerabilities and everything like that. The hope is that if you find somebody to work with, that it's somebody that you feel comfortable with, that there's a good fit. I mean, if they can be the best therapist in the world, and if you don't click or it's really awkward and maybe the therapist's style is very different than your style of speaking, and then it's going to be hard to get better. So it's important to feel comfortable with the person that you're speaking with. When people come to see me, especially people with anxiety, they're anxious. And so, I hope through talking that I can help them feel comfortable. I mean, I hear it all. So this is not new to me. This is, it would be hard to shock me. And, anxiety is a medical condition. So just like if you had diabetes, you would not walk into your primary care doctor with your head hung low and, ashamed, my pancreas, I can't get it to work. That wouldn't be the experience. But it's the same thing with anxiety. It's just that because anxiety is a normal human emotion, people then start to feel they should be able to control it. But when it's gone completely awry, it's very difficult to control. So in that, at that time, that's when, in addition to all of the other things, that medicine is appropriate. So in our sessions, sometimes it's helpful if people bring in notes, ideas, jot down what you want to get across, because some people's mind sort of goes blank when they're anxious. And, they leave here and they think, oh my goodness, I forgot to say, everything. So it's really important to, make sure that you have a backup, so that if you get so anxious that you can't speak, that you have, thoughts jotted down to talk about.
So now, all right, say I'm coming in here, I am your new patient. Good luck to you. What should I expect? Like, what, as far as this, a first session or even like a 20th session, what would I be expecting as far, because like I'm somebody, and I'm sure this is not just me, I need to know, I have to know what's going to happen. Because if I don't know what's going to happen, it's even more anxiety, because I'm like, I can't deal with it.
Sure. So it should be like a conversation. So I'm going to ask you why you're here, how you're hoping I can be helpful. What do you want? What are your goals? Because that's really going to guide our work together. And then in these conversations, I'll continue to, sort of weave this story of who are you? What's your life been like? What's your history? What's your family history? Is your great-grandmother, grandmother, your mother, your siblings, are they all anxious? How do they manage it? Are they all on medication? All of the things that we can find out in your history will help determine what sort of treatment plan we come up with. And, I think it's important to find out about you and then find out about what you're interested in doing. And so some people, absolutely no way am I ever going to take medicine. Well, that's fine. Here's a list of 10 things that could really be helpful. Let me help support you in trying these out. If it doesn't work, we can, consider medicine later. Some people just want medicine right away. And so it really, how our treatment plan will vary depending on who the person in the room is.
Okay, all right, I want to do like a Mythbusters therapist edition. Is it weird? Is it not appropriate to call you therapist? Is that like a...
I think that people get confused.
Yeah.
So, and that's actually a good question. So what is a therapist? What is a psychiatrist?
I think people just are all just, it's a person, the whole thing, it's just one thing.
Right.
A therapist.
Right. So psychiatrists can do therapy and do therapy. We are trained for a gazillion years, both in medicine and medications, but also how to do psychotherapy. And so it's a big part of our training. Because there are less of us to go around, sometimes we do more medication management than do therapy, but it really varies by the psychiatrist. So when people say a therapist, I think usually they're referring to a psychologist or a social worker, or, there's a lot of different training or licenses for therapists. So, but a psychiatrist can be a therapist also.
Okay, so then we'll do Mythbusters Psychiatrist Edition. Although we'll probably get in trouble for saying Mythbusters. So It's a show on TV.
Oh,
You
okay.
can't talk about other people's shows.
Oh.
So what are, like, because, people just assume 1,012 things are going on in this room. I know from experience most of those things are not true. So, like, do you hear, like, a lot of, like, cliche things of, like, well, if I come and talk to you, this might happen, or I don't want to tell you my secrets because this might happen, or is there anything that you experience that's like that you can just kind of, like, lay to bed now that's not necessarily true?
I think that what I hear the most might actually happen outside of these rooms. If somebody asks me, what do you do? Or they find out I'm a psychiatrist, it's almost a universal reaction. Oh my God, don't analyze me. Don't,
Don't read my mind.
Right. So I really feel that some people think I can read minds. And I can't.
You should charge extra if you could.
If I could, right. It would be fantastic. But I really can't. And so when people come in here with the idea that I really can read their minds, our treatment isn't going to go as well because I can't. And, it is, if people don't share all of the things that they're thinking and feeling, then I'm not going to know. And I might actually choose a therapy I wouldn't choose if I knew how the person really felt. So,
do you think a lot of people feel like they're going to get judged? I mean, I know.
Yes.
Yeah. And that's the whole point of coming here, is to talk to somebody who's not going to judge you. It's not like you're going to go to a friend who's going to be like, well, you're a freak, so I don't know what to tell you.
Right. And I think that happens. This is another myth that people should be able to control their anxiety, that anxiety or any mental illness is a weakness. And that's a very powerful message in our society that, I think it's getting better. I think people are starting to realize that it's not a weakness. This is, a medical condition that can happen. And, but I think because of the stigma around mental illness, people are embarrassed. They feel ashamed. Like, if I was a stronger person, I wouldn't be feeling anxious. I would be, pull myself up by the bootstraps and, do whatever I need to do. That a better person would not be anxious in this situation. And so people have they're so judgmental of themselves. There's nothing that I can think that's going to be worse than probably what you think of yourself.
Absolutely not. 100%. There's nothing anybody worse. And I always get from people, just let it go. Just let it go. You can't control it. Just let it go. You can't control what's going to happen. I'm like, if I could let it go, I wouldn't be freaking out. And that always seems to be something that people that don't experience it seem to just throw out there.
Right.
And then you come in here and you're like, well, I'm supposed to just be able to let it go. So you're supposed to make me let it go.
Right. But sometimes anxiety is so powerful that until you turn the dial down on that anxiety, sort of take the edge off that anxiety, it's hard to use any coping mechanisms. So, if we have to use medication to sort of take you from a 10 out of 10 bad to an 8 out of 10, maybe at an 8 out of 10 level of anxiety, you'll start to be able to work in therapy to let it go. And it's not that simple to let it go, but this is why sometimes medicines are needed, because people are not able to even do therapy when they're so anxious.
So what would you say to somebody who might be uncomfortable with the idea, but like deep down they feel like, I know I need to do this, but I'm just not sure about it? I think that there's no harm in reaching out. So, going to meet with somebody and saying, this is how I feel,
do you think it's a problem? Do you have suggestions? Are there ways that I can help myself? Getting an evaluation so that oh geez, this is really out of hand. I'm going to validate you. Wow, you're really suffering, and we need to do something about it. Let me help you. So, it's not, you don't have to go to a doctor, but depending on, where you are in life, speak to a teacher, speak to a guidance counselor, speak to a family friend, maybe a friend of yours that has anxiety, can sort of tell you about their own experience, and just reach out to people. Don't keep it inside and just let it fester within you, because that's it's really hard to convince yourself to get better. People get stuck in their own brains, and their brains are anxious, so it's not gonna go well sometimes. So just ask for help. There are lots of people, there are lots of us that are willing to help and want to help.
Great. Well, thanks so much for talking with us.
My pleasure.
Mm-hmm.
Roll it.
Okay.
No. Oh, let it go. Roll it.
Today we're here to talk to a psychiatrist to get the load. I like
That was good, Don. It looked good.
I looked funny.
Don't judge. Okay, ready? Roll.
Hey guys, if you're enjoying this series, check out my new book, A Hot Mess's Guide to Getting Your Anxiety and Depression in Check, on Amazon right now. Go check it out. You won't be sorry.